5 silent heart warning signs after 55. Let me ask you something. Have you ever found yourself slightly out of breath while talking and blamed it on just getting older? Or maybe you noticed you get tired faster doing things that used to feel easy. After 55, your heart and blood vessels go through a serious stress test. In modern cardiology, this stage is often described as a period of increasing vascular stiffness. Your arteries gradually lose elasticity. The left ventricle, the heart's main pumping chamber, may thicken to push blood through more resistant vessels. And here's the dangerous part. The heart can struggle quietly for years before it ever causes dramatic pain. Today on Mind and Body Insight, we're breaking down 5 subtle heart warning signs after age 55, the ones people often dismiss, and what they actually mean. And at the end, I'll share a simple 30-second breathing check you can try at home to estimate your cardiovascular reserve. Why the heart changes after 55. As we age, arteries become less flexible. According to the American Heart Association, nearly 70% of adults over 60 have some degree of hypertension, even if they don't feel symptoms. When blood vessels stiffen, the heart has to pump harder. Over time, that extra workload can cause the heart muscle to thicken, a condition known as left ventricular hypertrophy. At first, the body compensates beautifully. But compensation has limits. Let's look at the early signals. 2. A dry cough when lying down. This is sometimes called a cardiac cough. If you lie down at night and develop a dry, irritating cough that improves when you sit up or use a higher pillow, don't ignore it. Why does this happen? When you lie flat, fluids in your body redistribute. If the right side of your heart is slightly weakened, that extra fluid pressure can lead to subtle swelling in the lung tissue. This is not a cold. No fever, no infection. Just a cough that appears in bed, and often worse in the middle of the night. 3. Lower tolerance for everyday activities. This is the sign most often dismissed as just aging. Maybe grocery shopping now requires a rest break after 15 minutes. Maybe cleaning the house feels unusually draining. Here's what may be happening. Cardiac output, the amount of blood your heart pumps with each beat, may be slightly reduced. Your muscles receive less oxygen during exertion. One subtle clue? A sticky sweat on your forehead during light activity. Not heavy exercise, light activity. Your body is working harder than it used to for the same task. 4. Discomfort in the left arm or jaw during activity. Many people over 55 do not experience classic crushing chest pain. Instead, reduced blood flow to the heart, ischemia, may show up in unexpected areas. Why? Because the heart shares nerve pathways with other regions. You might feel a dull ache in the left elbow or wrist, tightness in the lower jaw, a strange toothache-like sensation during brisk walking. And here's the key. It appears with activity and disappears within 2 to 3 minutes after stopping. That pattern is important. 5. Rising diastolic blood pressure. If your bottom number, your diastolic pressure, consistently rises above 90 to 95 millimeters of mercury, even when the top number looks acceptable, that's not something to ignore. Diastolic pressure reflects the resistance in your blood vessels. When it stays elevated, it suggests your arteries are in a constant state of tension. In adults over 55, persistently high diastolic pressure is increasingly linked to a higher risk of atrial fibrillation, an irregular heart rhythm that raises stroke risk. Many people focus only on the top number, but the bottom number tells its own story. Key heart health indicators after 55. If you want to stay proactive, cardiologists recommend monitoring a few important markers. NT-proBNP blood test. This modern lab marker can detect stretching of the heart walls before obvious symptoms appear. Elevated levels may indicate early heart failure. Echocardiogram, heart ultrasound. This test shows wall thickness, valve function, and pumping efficiency. Left ventricular mass index. A measurement that indicates whether your heart muscle has thickened in response to pressure overload. Early detection changes outcomes. According to the CDC, heart disease remains the leading cause of death in the United States, but many cases are preventable with earlier recognition and management. The 30-second breathing check, Gensch test variation. Now here's something practical. There is a simple breathing reserve test that can give a rough idea of cardiovascular adaptation. Here's how to try it safely. 1. Sit comfortably. 2. Take a normal breath in. 3. Exhale normally. 4. Hold your breath at the end of the exhale. Time how long you can comfortably hold it without strain. For many healthy adults over 55, 20 to 30 seconds is typical. Significantly shorter times, especially under 15 seconds, may suggest reduced functional reserve. This is not a diagnostic test, but it can prompt a conversation with your physician. Always stop if you feel dizzy. The bigger message. After 55, your heart does not need rest. It needs intelligent care. Moderate activity, even 30 minutes of daily walking, improves vascular elasticity. Blood pressure control reduces heart muscle thickening. Regular monitoring prevents silent progression. If you've noticed 2 or more of the signs we discussed, don't panic, but don't ignore them either. Schedule an ECG. Ask about an echocardiogram. Check your labs. The heart whispers long before it screams. Listening early can prevent irreversible damage. If this video was helpful, subscribe to Mind and Body Insight for evidence-based guidance that supports your health at every stage of life. And tell us in the comments, which of these signs surprised you the most? Because awareness, especially after 55, is not fear, it's power.